Hello, my dear friends. Welcome back to your channel, Nursing Concepts by Raghav. See, this is an continuation video of the CA cervix. So, in the last video of the CA cervix, we have discussed what is CA cervix or the cancer, cervical cancer, and what are the causes and the risk factors for the CA cervix. What are the types and what are the clinical features and how do we diagnose it and what are the screening protocols. Okay, screening test. What screening test we do for the cervical cancers. So this is a continuation part of that video. So in this video I'm going to discuss uh, how do we stage the cervical cancer, because this is a very important concept in the cervical cancer. Okay, staging of the cervical cancer, staging based on the staging itself the treatment will vary or the prognosis of the patient can be decided. So in this I will discuss the staging and how do we treat the cases based on the stages. So that all things we will discuss in this video. तो चलिए शुरू करते हैं आज का कॉन्सेप्ट, that is a continuation part of the CA cervix. So if you are watching for the first time, please do subscribe and keep watch till the end. And if you like the video at the end, please do like and share it to your friends. तो चलिए शुरू करते हैं आज का concept. So we'll start with the staging process or the staging of the CA cervix. So the staging of the CA cervix was recommendations or the given by the FIGO. So FIGO stands for International Federation of Obstetrics and Gynecology. So they have given the staging of the CA cervix. So basic consideration under this recommendation or the FIGO staging method. So they consider the tumor size and the extent of the tumor, whether it has been extended or confined to a particular area or whether it is extended to the other areas as well. So that is considered, and the location, whether it is in particular area or it is extended to the other areas. Okay, extent, size, extension of the tumor, location of the tumor, and the lymph nodes involved, either the surrounding lymph nodes or the central lymph nodes are been involved, so that has also been considered. And even they consider the metastasis of the cancer. So means they are whether they are been spread to the surrounding structures or whether they are been spread to the distant organs as well. So these are the basic consideration in staging the cervical cancer are been considered under the FIGO staging. So nowadays this is a very important concept actually for the doctors and for the medicos, but even the NORCET has an interest in asking the question on this FIGO staging of the cancers. So let's discuss how the staging is being done under the consideration or the under the recommendations of the FIGO or the FIGO method of staging. So that is International Federation of Obstetrics and Gynecology. See here the basically CA cervix or the cervical cancer is being staged in four stages: stage 1, stage 2, stage 3, stage 4. So based on, again, this classification is majorly based on the size and location of the tumor and the metastasis of the tumors. So based on these three factors, this staging is being done. Again, every stage has a sub clinical types or the subtypes of staging. So again, that based on the some variant factors that we will discuss in detail in this staging. So let's discuss the first stage 1. In the stage 1, it is confined to the cervix. See here the cancer cells or the cancer or the tumor is been confined to the cervix, means it is not going beyond the cervical area or the cervix area. So means the whatever the lesions we found, they are been confined to the cervix. Okay, so either to the cervical area, so they are been confined, means or they are been located only in the cervix. They don't go beyond or they are not being extended beyond the cervix. So again the stage 1 is been subclinically divided into A and the B, that is 1A, 1A and the 1B. See this 1A is based on the again size, it is microscopic. means where the tumor size is very small. Okay, we cannot clinically it is not visible. Under microscope we can see the lesion or the tumor. See here, based on the size, again this A subtype has been divided into type, that is A1 and the A2. So in the A1, the size is less than or equal to 3 mm. Okay, less than or equal to 3 mm. And in the A2, where the size is more than 3 mm but it is less than 5 mm. So that means, so in the A2, the size between 3 to 5 mm, not more than this. And very important thing you should remember is this is microscopic. This is microscopic, means it can be seen only under the microscope. That means the tumor size or the lesion size is very small. Okay, so 3 to 5 mm, uh, that is category or the stage 1A. In the stage 1B, where the size has grown up and it is clinically visible now. Now it is, sorry, now the size is clinically visible, where the, but still it is confined to the cervix. Remember, in the stage 1 it will not go beyond the cervix, so it is confined to the cervix itself, but only the size. Okay, based on the size only we have a sub stages. So in the B substage, again we classify them into B1, B2 and the B3. So in the B1, where the size lesion is more than 5 mm depth, but it is less than 2 centimeter. Okay, so that means here it is between the 5 mm to 2 centimeter. The depth of invasion means how much it has been invaded into the cervix. So that is what the depth of invasion. So the lesion is 5 mm depth or maximum up to 2 centimeter. In the B2, where the size is more than a 2 centimeter but less than a 4 centimeter. Less than 4 centimeter. That is 2 centimeter to 4 centimeter. And in the type 3, that is B3, where the lesion is more than a 4 centimeter. Where it is, the lesion is more than 4 centimeter. So what you can, if you make a concise of the stage 1, where the size basically varies between the 3 mm up to the maximum of 4 centimeter. Okay, overall in the stage 1, the size of the lesion may vary between the 3 mm to 4 centimeter, or more than up to 4 centimeter. So if you consider the subtypes, in the type 1, that is substage subtype 1, so where the size is between the 3 to 3 mm to 5 mm, whereas in the subtype 2, where 5 mm to up to 4 centimeter. So this you can remember, or overall the size between the, or in the stage 1, 3 mm to 4 centimeter is the size of the tumor or the lesion. And remember, it is confined to the cervix, it is not beyond the cervix, or it is being located within the cervical region. So this is stage 1. Then stage 2. In the stage 2, see here the tumor has extended beyond the cervix, but not involving the pelvic wall and not involving the lower one third of the vagina. So that is a very important thing you should remember. In the stage 2, what happens, it extends beyond the cervix, there is no involvement of the lower one third of the vagina and the pelvic wall. So again here, involvement, that is after beyond the cervix, what organs were involved or where it has been extended. Again we have a subtypes, that is 2A and the 2B. 2A and the 2B. In the 2A, again we have subclinical types A1 and the A2. See in the A, subtype A, it involves the upper two-third of the vagina. Okay, and no parametrial invasion. So means, see here, if you consider the cervix, this is a vagina. Okay, this is vagina. See the upper two-third. So upper two-third of the vagina is been involved in the cancer, or the tumor has been extended up to the upper two third. This is the lower one third. This is lower one third. This is upper two third. So the two third of the vagina, upper two third of the vagina has been inward, and there is no parametrial invasion. What is parametry? The parametry is parametry. See, para stands for the surrounding, metry stands for the layers. Means the layers which surrounds the uterus or the cervix, they are been involved. They are that is called as a parametry. But here in the type stage 2 type A, there is no involvement of the parametry. Okay, so parametry is not been involved in the type A, that is stage 2 type A. So here the lesion is more than a 4 centimeter. Okay, lesion is less than 4 centimeter, and here the lesion is in the type 2 A2, that is lesion is more than a 4 centimeter. So remember, in the stage 2 type A, where there is involvement of the two third of the upper two third of the vagina, no parametrial invasion. In the B subtype B, where there is an invasion into the parametrial layers, that is surrounding this, the surrounding these layers. So these layers were involved in the invasion, so that is called as a stage 2 type B. But the pelvic wall is not being involved. Okay, so pelvic wall is not involved. So just remember, in the stage 2, the tumor has extended beyond the cervix, involving the parametry. Okay, so that is, and the upper two third of the vagina. So in concise, what we can remember is, it is involving the two third of vagina plus the parametry. So this is being involved. Okay, so in the type 3, in the type 3 here, there is invasion to the pelvic wall and the lower one third of the vagina, and even the kidneys, ureters were also being involved in the cancer process. So again, based on the involvement, there are subtypes: type A, type B, that is 3A, 3B, and the 3C. In the stage 3A, it involves the lower one third of the vagina, but not the pelvic wall. And in the type that is 3B, it extends to the pelvic wall and causing the hydronephrosis, or it involves the kidney and leading to the, or it will make the kidney non-functional. In the third C, where the pelvic wall, para-aortic lymph nodes, pelvic lymph nodes and the para-aortic lymph nodes were involved. So this is usually being diagnosed with the help of imaging technique, that is a PET scan and all we do to consider or to diagnose the cases of stage 3, the C. Okay, so here overall what we can remember is, so here in the type A, see the lower, this is two third, so the invasion has extended to the lower one third of the vagina. Okay, then in that B type, where the pelvic wall, see here the kidneys were also being involved. So means the pelvic wall means it is the structures which bonds in, or it surrounds the true pelvis. So that is called as a pelvic wall. So means in the pelvic wall we have kidneys, ureters, all these will get affected and causing the hydronephrosis. Then 3, in the types 3, there is an involvement of the lymph nodes. So pelvic lymph nodes and the para-aortic, that is aortic lymph nodes. So aortic lymph nodes were also being involved in the cancer process. So that is stage 3 type C. Okay, so in the again type 3, if lymph node, that is pelvic lymph nodes were involved, that is C1, and para-aortic lymph nodes were involved, then C2. So this is what the stage 3. So overall concise, what we can do is, see here lower one third of the vagina is involved, pelvic wall is involved, and kidneys were involved. So that is the stage 3. Then coming to the last stage, that is stage 4, where it spreads beyond the pelvis and there is an invasion into the bladder, rectum, and even the distant metastasis will occur. So again in the stage 4 A, stage A, and the stage B, so where in the stage A it involves the, or the cancer invades into the bladder and the rectum, and in the type stage 4b, where there is a distant metastasis, means the cancer spreads to the distant organs like lungs, liver, and the bones. Okay, and many other organs were involved in the metastasis. So this is what the stage of 4. Okay, so this is all about how do we stage the CA cancer, CA cervix according to the FIGO staging. This is very important. So in general, or if you concise this all things, so the stage 1 is confined to the cervix. In the stage 2, where it goes beyond the cervix but not involving any pelvic wall, only the perimetrium can be involved in the stage 2. Then stage 3, their involvement of the pelvic wall, lower one third of the vagina, lymph nodes, and the kidneys were involved. In the stage 4, bladder, rectum, and distant spread to the lungs, liver, then bones, all these things will happen in the stage of 4. So this is an precise staging of the CA cervix. So if you look at the picture here, see in the stage 1, this is confined to the cervix as I told. See here, the lesions were not being extended beyond the cervix. Okay, so you can see this, only the, you can see the lesions here. So they are not being extended beyond the cervix. They are confined to the cervix. So based on the size, again, A1, A2, B1, B2, B3, all these were the based on the size. Then in the stage 2, so it is extended beyond the cervix. Okay, beyond the cervix, and there is a parametrial invasion. See, the parametrium is being inward here. That is a stage 2, a B type. Okay, that is type B. So cervix plus parametrium, no any pelvic floor is being involved. In the stage 3, so it involves the lower one third, of the vagina. See, the it has been extended here to the lower one third of the vagina, and even the pelvic wall also been involved. So the kidneys were also being involved. There is an hydronephrosis. Okay, and even there is an involvement of the, see, the lymph nodes, pelvic lymph nodes, then para-aortic lymph nodes were also been involved in the stage 3. And in the stage 4, there is, it extends to the rectum. Okay, the cancer extends, or there is a metastasis to the rectum, then the bladder, and even there is distant metastasis to the lungs, liver will happen. So this is a picture showing the stages of like CA cervix according to the FIGO. Now let us discuss how can we prevent. So as I told, the CS cervix can be a preventable. So we can prevent this by proper screening techniques, or the proper screening methods. So screening, as I explained in the last video, so screening is done by using the pap smear. Pap smear. So as I told, a pap smear will be done. Okay, screening will be done to identify the cases of the CA cervix in the early cases or in the early stages. So it will help you to identify the precancerous stages, and even the help you to identify the cancer status. The pap smear, as I told, so this is in the age of, screening will be done from the 21 years of age, not below this. From 21 to 29 years, once in 3 years, for every 3 years, 3 year once, so they should have a pap smear testing. And after 29, that is 30 to 65 years, every once in 3 years they should go for the pap smear, or else for every 5 years they should go for a pap smear testing plus HPV DNA testing. Either 5 years once they should go with both the test, or every 3 years they can go only with the pap smear. So after the 65 years of age, either they can stop it. If there are negative reports or the normal reports were found in the last 10 years, then they need not to go for any screening test after the 65 years of age. So this is what the screening will help you to prevent the CA cervix. Then the second is vaccination. This is very important. So the girl should get a vaccine so that she can be prevented by a a cervix. So this is a very effective method of preventing the a cervix in the women or in the girls. See, the vaccination recommendation, that is usually it is being given by the age of 9 to 14. So this is an ideal age, because so during this age there is no any sexual activity will takes place with the girl child. So so this will be considered for an ideal age. So after that usually the girls, they may go for an sexual activities. So it is being recommended before the sexual activity starts, or the before the age of sexual activity starts, the child or the girl should have this a vaccine, that is human papilloma vaccine should be given by the age of 9 to 14. A single dose is usually recommended, and it is highly considered highly effective if it is given in the age of 9 to 14. So if it is given after the age of 15 years, then three doses will be given at 0 to 6 months apart. Okay, first dose is at 0, then 2 months apart, then 6 months apart. Three doses of SPV vaccine will be given. So this is usually recommended. This is recommended by the CDC. So this varies in different countries. They have their own recommendations for giving the HPV vaccination. So this is ideally considered for HPV vaccination single dose for the 9 to 14 years, or else after the 15 years, so minimum of three doses will be given 0 to 6 months apart. Okay, so this is about the HPV vaccination. So how we can prevent the cervix. Then coming to the management, so the management depends majorly on the staging. So stages of the cancer will decides the treatment. So in the precancerous stage or the precancerous lesion, where we can go with the cryotherapy. So cryo means it is freezing. So what we do here we with a very lower temperature, we will freeze the cells with an extremely low temperature so that the cells will die. So with the help of one liquid nitrogen, we create or we will freeze the cells, and cells will die, that is the cancer cells will die. That method we call it as a cryotherapy. And we have another method that is LEAP. LEAP means loop electrosurgical excision of the tumor. Okay, excision procedure, so that is called as a LEAP. So means if the tumor size is very small, with the electrosurgical method we can excise it or we can remove it from the cervix. Then there is another method called as a conization, where the cone shaped area of the cervix will be removed. Okay, so means cone shaped area, so that is okay like this will be like this, no, a cone shape. This part they usually remove it. That process we call it as a conization, that surgical procedure, conization. So this is in the early case of or the precancerous stages of the cervix. And in the stage 1 and stage 2, if the patient is in the stage 1 and stage 2, stage 1 AB, where they may consider the hysterectomy for the cases. Hysterectomy, the approach may be different, like a vaginal hysterectomy or the abdominal hysterectomy can be considered, or the radical hysterectomy can be considered. Okay, so any approach based on the extent of the disease, so hysterectomy will be advised for the patient. And if there is a locally advanced cases, so where we go with the chemoradiation, that is chemotherapy along with the radiation, we do treat the cases. That is chemo we use is the cisplatin, and the radiation along with that we use. Then in case of advanced cases or the distant metastasis, where the patient is very difficult to treat the cases, in such cases we can go only with the palliative care, and a chemotherapy can also be used in the treatment of an advanced or metastatic cases. So this is all about the how do we manage the cervix cases. So that's all for the today's session. Hope you all understood the uh, whole concept of cervix, what it is, what the cervix is, what are the causes, what are the clinical features, how the FIGO staging is done. Okay, how do we classify, or how do we stage the cervix based on the tumor size, extension, then involvement, metastasis, all these things were considered in staging the cancer. Then how do you manage? Okay, what is the screening, when do we do the screening, recommendation for the screening, then HPV vaccination. All these we have discussed in detail. So hope you all understood this whole concept, and this is an important topic for the NARCET as well, and for the upcoming exams as well, and even for the students those who have an OBG subject. This is a very important topic for their academic exams as well. So do prepare well, and keep watching my channel. And if you like the video, please like it and share it to your friends or your students, those who are in need of these classes. So till then, take care and bye bye.